Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies within the service. This month, we'll be focusing on the following policies: the Service Code of Conduct and Disciplinary Procedures, Ghana's Roadmap for Achieving Universal Health Coverage 2020 to 2030, and the National Health Policy 2020. In this presentation, we will concentrate on Ghana's roadmap to attaining universal health coverage. Ghana defines universal health coverage as all people in Ghana having timely access to high-quality health services, irrespective of ability to pay at the point of use. The goal is increased access to quality essential health care and population-based services for all by 2030. This means that all individuals and communities will receive the health services they need without suffering financial hardship. It includes the full spectrum of essential and quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. Presently, access to services by the population is uneven. Service availability and quality of care is generally below expectation. The National Health Insurance Scheme covered only 36% of the population in 2018. This means that 64% of the population are exposed to out-of-pocket expenditure or are simply not accessing normative care. There are other systemic bottlenecks. Only 20% of NHIS resources are spent on primary health care. Only 34% of CHIP zones and 43% of health centers have the full complement of equipment needed to provide services. There's regular stockout of medicines as well as essential maternal and child health record books. Only 49% of existing CHIP zones have an appropriate service delivery facility. There is a poor mix and maldistribution of critical health personnel and health facilities. The objectives of Ghana's Universal Health Coverage Roadmap are: universal access to better and efficiently managed quality health services, reduce avoidable maternal, adolescent and child deaths and disabilities, increase access to responsive clinical and public health emergency services, progressing towards universal health coverage. Moving towards UHC requires strengthening health systems, strong financing structures, improving health service coverage and health outcomes. The achievement of these objectives will be based on the availability, accessibility, and capacity of health workers to deliver quality, people-centered, integrated care. Therefore, investments in quality primary health care will be the foundation of achieving universal health coverage across the world. Good governance and leadership, sound systems of procurement, supply of medicines and health technologies, and well-functioning health information systems are other critical elements necessary to make progress towards UHC. Policy direction. Ghana can achieve universal health coverage through the 5-point guiding principle that identifies the poor and vulnerable as the main target group, seeks to eliminate the financial risks involved in utilizing healthcare services, promotes sustainable partnerships between government, private sector, non-state actors, and development partners, promotes decentralized management of services, and prioritize the allocation of domestic resources to primary healthcare services. Now a look at the primary healthcare system. The primary healthcare system consists of the district hospitals, health centers, maternity homes, CHIP zones, and other community services. The PHC package offers maternal, child health and nutrition services, services for communicable and non-communicable diseases, mental health services, preparedness, response and management of all types of emergencies, including road traffic accidents, clinic and public health emergencies, and issues related to natural disasters and floods. There is significant potential to increase the proportional contribution of primary health care to service delivery over the next 10 years. Priority interventions. Priority interventions will be achieved by the provision of essential services for the population, management of clinical and public health emergencies, improvement in the quality of care and information management, enhanced efficiency in HR performance, institutional reforms for sector effectiveness, as well as health policy, financing, and system strengthening. UHC Results Framework. Measuring progress towards attaining universal health coverage in Ghana is leveraged on the following: the Universal Health Coverage in Africa Framework, the Astana Declaration Framework, and the targets and indicators of the health-related sustainable development goals.
Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.